Hi, how are we doing today?
Good, how are you?
Good. So my name's Michelle. I'm going to be your nurse today. I'm Daniel's nurse. I just wanted to check in and see how you were doing. Can you go ahead and tell me your name and your date of birth?
Sarah Thompson, October 14th, 1997.
All right, Sarah. So I know that you just got a diagnosis. I just wanted to check in with you and see how you're doing. If you have any questions that I can answer, I just want to make sure that you're completely aware of what's going on.
I do have a few questions.
Okay.
You know that my symptoms were just tightening and reduced range of motion. What is the cause of my symptoms?
So the cause of your symptoms, with linear morphea scleroderma, you have a autoimmune condition where you have an excessive amount of collagen that builds up in your skin, so it can lead to thickening of your skin, hardening, even color changes, which can honestly reduce your range of motion with that thickening of skin.
Okay. Are there any possible causes?
So not as of right now, there's no causes actually known, but if any other possible cause, it would be scar tissue, trauma. You can have connective tissue disorder, which it's very unlikely. This is not what we're seeing. But those are some other things, but it's just not following in with your symptom patterns.
Okay. Is there any tests that I'm going to have to get for this?
Yeah, so we'll have to do a skin biopsy just to confirm and make sure that we're doing everything with the right stuff. And then we'll have to do a blood test, which will indicate your autoimmune markers. And then we'll do a range of motion assessment to see how bad it has gone, but not everything requires testing.
Okay. And how long will these skin changes last?
So you normally have an active phase and a deactive phase. So you're in your active phase, it's gonna last for a good while. So within a couple months to maybe a few years. But your inactive phase, so you'll have some different changes and improvements where most of everything will be kind of permanent.
Great.
I know, I'm sorry.
If the skin discoloration and hardening clears up, will it ever come back?
So it is possible to come back, but normally it is only ever seen to just hit once and be done. But within the first few years of treatment, it can come back a couple different times.
Okay. What treatments are available and what do you recommend?
So we have you set up with a pharmaceutical therapy, which would be your methotrexate, which is once a week. You're just going to pick a random day through the week. You want to take that once a week. With that, you have to take a folic acid. That's just kind of balance everything else out. You will also take that every day. And then you'll do a steroid topical ointment, or cream if you prefer a cream. We're going to do that twice a day. So in the morning and then right before bed, you just want to kind of cover it. That'll help with the thinning of the skin to help move a little bit more. And then if possible, you could do steroid shots. Let's say you flare up and it starts to become active again. Steroid shots help. And then I also would like to try the phototherapy. That is something where you take what kind of looks like a tanning bed light, but we're going to use it in a localized spot. So it would be more or less putting your arm in a tanning bed, since that's where it's at.
Okay. What side effects can I expect from the treatment?
So with your steroid cream or ointment, you'll have that thinning of the skin, whereas in that methotrexate can lead to nausea, vomiting, mood changes, fatigue, and then if you do the steroid injections, you will have an increased infection risk as well.
Okay. I have other health conditions. How can I best manage them together?
Okay, what other health conditions do you have?
I have acid reflux.
Okay, that's easily manageable. We can totally work with that. So who diagnosed you with that?
My previous doctor.
Okay. So do you still see them?
Yeah.
Okay. So we'll just want to make sure that we coordinate care plans and put everything together. Monitor medications, making sure that we're not having any contraindications with the medications that we're prescribing you and medications that they may have you on. And then we just want to maintain healthy lifestyle, so exercise and hydration, and make sure we're following a certain amount of diet and stuff like that.
Okay. What can I do to improve my appearance?
Okay, so it may come off as ugly, which is totally understandable. You can use moisturizers, which will help thin, and it might be kind of dry and maybe itchy, so it might help with that. And then you can use makeup if you would like to try and cover it to like camouflage it in. Therapy should also help darken the skin instead of it being a bright white inflamed area. And that dark brown indication is your inactive phase, and it'll help more or less camouflage into your skin itself.
Okay.
Especially if you're tanning through the summer or even through the winter. You just want to make sure if you are tanning in a tanning bed to make sure we're using sunscreen everywhere else.
What happens if I don't use sunscreen?
Honestly, it'll probably help the skin condition itself,
You
but
think?
it'll inflame the rest.
Right. Okay. Well, thanks for that advice.
No problem.
Do you have any brochures or other printed materials that I can take home with me?
I do. I believe I left it out in the office. Give me just a second. I'll be right back.
Okay.
Okay, and here's this packet here. You're just gonna take that with you. It's got everything in there. If you do have any more questions or anything like that, feel free to call us. We're here for anything. Do you want to go over your treatment plan as of right now, other than the medications we have you put on?
Yeah, you can.
Okay. So we have you down as we're gonna do physical therapy, which is downstairs. We're gonna do that twice a week minimum. You can do more if you'd like. Just to make sure we're keeping that range of motion going good. And then we're gonna follow up every 3 months here with Dr. Ross.
Okay.
And so your next appointment will be in February. Labs every 4 weeks. We're gonna take labs today before we start you on your medication. That way we have a baseline. And then from there we'll go every 4 weeks. I did tell you you're gonna be on that methotrexate once a week, your folic acid daily, and your steroid ointment, you'll do that twice a day. If anything changes, feel free to call and we'll make you an appointment before then. But this is just the stuff they just want to tell you that you have to attend your follow-up appointments every 3 months, and then if you won't see myself, then you'll see one of the other nurses, but it'll always be someone under Dr. Ross. And that we do encourage you to go to these support groups if you would like. There's plenty of people out there, and they may be able to answer some other questions that you may have, but they just want you to know that you're not alone. Okay, so anything that we can help with will help. You are scheduled back in February, but if we need to see sooner, if you have progression or anything like that, call and let us know and we'll get you in sooner.